Finding mentorship in dentistry, a step-by-step guide. Are you a dentist seeking guidance and mentorship to excel early and, more importantly, all throughout your dental career? If so, this video is perfect for you. Today I'll walk you through the step-by-step process of finding the perfect mentor in dentistry. The first and most important step to finding a mentor is to decide what type of mentor you actually want. It is essential to take time to accurately define the kind of mentor you are looking for. For example, there is this substantial difference in what you will learn whether you need help learning complex dental procedures such as placing implants or extracting third molars, or if you'd rather focus on learning how to build a successful dental practice. Without a clear understanding of the mentor you are seeking, it is unlikely that you will find the right person by just chance. We must ask the right question first, Grasshopper. Therefore, I suggest you spend time creating an avatar of your ideal mentor. Once you have a clear image of the type of mentor you want to learn from, you can proceed to the next step. Next, research potential mentors who match this profile. This is often carried out in the job search process. But if you are already locked into an associateship and not finding mentorship at that position, I have hopes for you as well, so stick with me. In my career, I have found two primary sources of mentorship: either the dentist you work with daily at your associateship or someone in your local community. The person you work with is an obvious first choice, but not an option for solo providers or doctors already locked into an associate agreement. Therefore, as a second choice, one could consider a doctor in your local community. I suggest within driving distance. This person should also have 5 or 10 more years of experience than you, but probably not more than 20 years ahead of you in your career. This local dentist is close enough to you in age that they can still relate to your position and your career experience, but also has had enough real-world experience to provide you some valuable insights. It's worth noting that while more experience is generally better in terms of mentorship, there can be a subtle psychological barrier between recently graduated dentists and those with maybe 20 or more years of experience due to the stark differences in age and the way each practices dentistry. I'm not going to get into semantics, but realize mentors that are much older can sometimes act pejoratively as opposed to providing helpful counsel. While it's not impossible to find an older mentor, from my experience working with newer dentists, it can be difficult to find the common ground necessary to create a successful mentor-mentee relationship if the two of you are just more than 20 years apart in your careers. A common area I have seen mentees have success in finding mentorship is through study clubs or mastermind groups within their communities. These groups of people meet regularly, usually in close geographic proximity, and often comprise of people with similar interests. By joining a mastermind group, you can quickly identify who has the most knowledge and who is most likely to be willing to mentor you. Take advantage of these relationships and see if a mentor is waiting to be found in your mastermind group. Once you have identified potential mentors, it's time to take initiative and start building relationships. Compose a polite and succinct message introducing yourself, expressing your admiration for their knowledge, and politely inquire if they would be open to mentoring you. Ensure that your communication is professional yet genuine. In some cases, the transition might happen more automatically, and somebody may even proactively offer to assist you. This is a terrific way to enter a strong mentor-mentee relationship. This person is already eager to help somebody develop, so it is likely a mutual exchange where you will both benefit during this mentorship relationship. Once you have found a mentor, feel grateful for any assistance you receive and be honest with any issues or concerns that you may have. After you have identified a potential mentor, it's important to create a trusting and respectful mentor-mentee relationship. The best way to let your mentor know you care is to be prepared. Prior to your meetings, prepare by having a list of questions or topics that you would like to discuss. If your practice doesn't have an intro or a camera, buy one. I got one for under $200 and I use it constantly, and I take it with me between associateships. Start documenting your work so your discussions with the mentor can have something tangible to look at, or even better, draw. Compile your radiographs, clinical patient information like diagnostic casts, or any other pertinent information for discussion prior to the meetings. Obviously, bring these items to the meetings and wow your mentor with your preparedness. Show your mentor that you recognize their expertise by being an attentive listener and carrying out their advice. Be open and honest with your mentor about your success as well as your struggles. To maintain the mentor-mentee relationship, Consistent effort and appreciation are required. Regularly update your mentor on your progress. Ask for their advice when needed and thank them for their support. Remember, mentorship is a two-way street, so always be willing to offer your assistance and give back wherever you can. I personally enjoy learning through the show, try, teach model. In this model, the mentor will show you something. Next, you try the same action while the mentor watches over you. They finally teach you what you could have done differently. An example, the mentor removes an impacted number 17 while demonstrating his or her technique. Next, you remove the impacted number 32 while your mentor watches. Finally, they teach you what could have been done differently. This type of learning is effective on visual learners, hands-on learners, and learners that just enjoy feedback. Over the years, working with 3 different mentors, I composed a list known as the ABCs of being a great mentor. You can use this as a sort of litmus test to see if the mentor you are thinking of or interested in working with would be a great option. This list isn't perfect for everyone, but should give you a good starting point at a minimum. The ABCs of a great mentor. A, availability or accessibility. Your mentor should make themselves available and accessible to you. They should be able to answer your questions promptly and be willing to give you feedback frequently. B, they should be bona fide or badass. They need to have a level of expertise in the field that will make you want to learn from them and want to look up to their guidance. They should be 2 or 3 levels ahead of you in your career. Letter C, committed to your growth. Your mentor should have a vested interest in your success and be willing to help you reach your goals. Letter D, development. They should have a passion for growth and development, both inside and outside the dental office. E, expertise or experience. The mentor should have a wealth of experience and expertise in the field, so that you can feel confident in their knowledge. By following these steps and actively seeking mentorship within your dental community, you can pave the way to a successful and fulfilling career in dentistry. Lastly, be sure to thank your mentor for any help, and also be aware that as you progress into your career, you are likely to surpass the skills of your mentor. This was a really cool feeling for me. At this point, you aren't done learning, but instead, you're just ready for a new mentor. So start the process all over again by defining exactly what it is that you want to learn. Then seek that out. Like I mentioned, I have had 3 mentors in my 3-year career. I learned surgical extractions and crown and bridge from the first one. I learned advanced endodontics and Invisalign from the second, and have been learning full mouth rehabilitations and implant dentistry from my 3rd mentor. Next, I will look for a mentor more on the business side of dentistry, as long-term, I aim to be a practice owner. Please comment with your experience finding a mentor. What have you learned? If you enjoyed this video and learned something, slam the like button and give me a follow on Instagram at The Educated Associate or on Facebook at The Educated Associate. Or if you're seeking more information, you can find that at theeducatedassociate.com, where you can also download my ebook for free. And as always, stay drilling, my friends.